Hello everyone, welcome back to Vitality Vortex Channel. Today we're diving into a crucial topic that can save lives, recognizing and managing strokes. Have you heard of the B.E.F.A.S.T method? It's a simple way to remember the warning signs of a stroke, and knowing it can make all the difference in an emergency. In this video, we'll break down what B.E.F.A.S.T stands for, the key signs and symptoms of a stroke, and what you need to do if you or someone around you experiences these symptoms. We'll also cover essential management tips and how to support recovery and prevention. Stay tuned because this information is not only vital for your health, but also for the safety of your loved ones. Let's get started and empower ourselves with the knowledge to act swiftly and effectively when it matters most. Understanding and responding quickly to a stroke can significantly improve outcomes. The acronym B.E.F.A.S.T is a useful tool to recognize the signs of a stroke and take immediate action. Here's a detailed look at B.E.F.A.S.T, the signs and symptoms of a stroke, and its management. So, what does B.E.F.A.S.T stands for? Balance. Sudden loss of balance or coordination. If a person suddenly feels dizzy, unsteady, or has trouble walking, it could be a sign of a stroke. This can manifest as stumbling, difficulty maintaining posture, or a feeling of spinning like vertigo. Eyes. Sudden trouble seeing in one or both eyes. This can include blurred vision, double vision, or complete loss of vision in one eye. Changes in vision can be a crucial early warning sign and are often overlooked. Face. One side of the face droops or feels numb. Ask the person to smile, and if one side of the face appears uneven or droops, it may indicate a stroke. This facial asymmetry is a key indicator of muscle weakness or paralysis on one side. Arms, weakness, or numbness in one arm. Ask the person to raise both arms, and if one arm drifts downward or cannot be raised at all, it could be a stroke. This arm weakness is often accompanied by a feeling of heaviness or complete loss of strength in one arm. Speech. Slurred or garbled speech. If the person has difficulty speaking, seems confused, or is unable to understand speech, this is a warning sign. They might slur words, speak in a halting or garbled manner, or be unable to repeat a simple sentence. Time. Time to call emergency services. If any of these symptoms are present, call emergency services immediately. Every second counts in treating a stroke. Quick response is crucial to prevent long-term damage and improve the chances of recovery. So when you recognize these symptoms, do you know what to do next? Immediate actions. Call emergency services. As soon as you suspect a stroke, call emergency services. Immediate medical attention is crucial to limit brain damage and improve recovery chances. Note the time. Record the time when symptoms first appeared. This information is critical for medical professionals to determine the appropriate treatment, especially for administering clot-dissolving medications. Stay calm and safe. Ensure the person is in a safe position, preferably lying down with their head slightly elevated, and wait for medical help to arrive. Do not give them food, drink, or medication unless instructed by emergency personnel. What are the medical treatments available for stroke? Emergency room assessment. Once at the hospital, the medical team will perform a quick evaluation and imaging tests, like a CT scan or MRI, to determine the type of stroke. The type of stroke, whether ischemic or hemorrhagic, dictates the specific treatment approach. We'll explore the different medications used to manage and treat strokes, how they work, and the critical timeframes for their administration. Understanding these treatment options is crucial for anyone looking to support stroke recovery or prevent further incidents. So, stay tuned as we dive into the specifics of stroke medications and their roles in effective stroke management. Ischemic stroke. 1. Clot-busting drugs. The most common type of stroke, ischemic stroke, occurs when a blood clot blocks a vessel in the brain. Immediate treatment often involves the administration of clot-busting drugs, also known as thrombolytics. One of the most effective thrombolytics is TPA, tissue plasminogen activator. TPA works by dissolving the clot and restoring blood flow to the brain. For maximum effectiveness, TPA must be administered within a few hours of the onset of stroke symptoms. 2. Antiplatelet agents, medications such as aspirin and clopidogrel, help prevent new clots from forming. 3. Anticoagulants. Drugs like warfarin, dabigatran, or apixaban may be prescribed to prevent clot formation in patients with conditions like atrial fibrillation. Hemorrhagic stroke. 1. Blood pressure. Management. High blood pressure is a common cause of hemorrhagic strokes, and controlling it is crucial to prevent further bleeding. Medications such as beta blockers, ACE inhibitors, or calcium channel blockers may be used. 2. Anticonvulsants. To prevent seizures that can result from brain bleeding, medications like phenytoin or levetiracetam may be prescribed. 3. Diuretics and other drugs. Medications to reduce brain swelling, edema, and lower intracranial pressure such as mannitol or corticosteroids may be used. Surgical interventions. 1. Thrombectomy. For some ischemic stroke patients, especially those who are not candidates for TPA, or if TPA is ineffective, a mechanical thrombectomy might be performed. This procedure involves the surgical removal of the blood clot from the artery. 2. Aneurysm clipping or coiling. In cases of hemorrhagic stroke caused by an aneurysm, surgical options like aneurysm clipping or endovascular coiling may be necessary to stop the bleeding. 3. Craniectomy. To relieve pressure on the brain, part of the skull may be removed temporarily in a procedure called a craniectomy. Now let's talk about rehabilitation. Stroke can have a profound impact on a person's physical and cognitive abilities, but with the right rehabilitation strategies, many can regain their independence and improve their quality of life. We'll explore various types of rehabilitation, including physical therapy, occupational therapy, speech therapy, and psychological support. Understanding these approaches can make a significant difference in recovery outcomes. So let's get started and learn how rehabilitation can help stroke survivors on their journey to recovery. Physical therapy, movement, and strength. Physical therapy focuses on exercises and activities designed to improve motor skills, balance, and coordination. This can involve strength training, balance exercises, and range of motion activities. Mobility training. This includes learning to use assistive devices like walkers, canes, or wheelchairs to enhance mobility and independence. Occupational therapy. Daily activities. Occupational therapists help stroke survivors relearn and adapt to everyday tasks such as dressing, bathing, cooking, and writing. This may involve practicing fine motor skills and using adaptive equipment. Home modifications. Therapists may suggest modifications to the home environment to make daily activities easier and safer. Speech therapy, communication skills. Speech therapists work with stroke patients to improve their ability to speak, understand, read, and write. This may include exercises to strengthen the muscles used in speech and techniques to improve articulation. Swallowing therapy. For those with dysphagia, difficulty swallowing, speech therapists provide exercises and strategies to make swallowing safer and more effective. Psychological support. Emotional coping. Counseling or therapy helps stroke survivors and their families cope with the emotional aftermath of a stroke. This support can address issues such as anxiety, depression, and frustration. Support groups. Joining a support group provides a sense of community and understanding, offering emotional support and practical advice from others who have experienced similar challenges. Strokes can be life-changing events, but with the right strategies, they can often be prevented and their impacts managed effectively. We'll cover essential tips on how to reduce your risk of having a stroke, as well as long-term management techniques for those who have experienced one. From lifestyle changes and medications to rehabilitation and support systems, we have got you covered. Stick around to learn how you can take control of your health and reduce the risks associated with stroke. Lifestyle changes. Adopt a healthy diet, exercise regularly, quit smoking, and limit alcohol intake. These changes can significantly reduce the risk of a first or subsequent stroke. Medication. Manage underlying conditions such as hypertension, diabetes, and high cholesterol with appropriate medications. Regular use of prescribed medications can help control these risk factors. Regular checkups. Regular monitoring and checkups with healthcare providers to manage risk factors and ensure any new symptoms or changes in health are addressed promptly. Recognizing the signs of a stroke with B.E.F.A.S.T and seeking immediate medical attention can save lives and improve recovery outcomes. Understanding and managing the long-term effects of a stroke involves a combination of medical treatment, rehabilitation, and lifestyle changes. Always consult with healthcare professionals for personalized advice and treatment plans. Thank you for watching. If you found this information helpful, please give this video a thumbs up, subscribe to our channel for more health tips, and hit the notification bell to stay updated on our latest content. Have you or a loved one experienced a stroke? Share your experiences and tips in the comments below. We'd love to hear from you.